Hello Mary, Conor Gallagher here from the dental practice in Fenian Street. And just on a follow-up from your consultation, I'm going to go through your scan and your X-rays and advise you what we think needs to be done. So I'm going to share the scan with you initially, and then I'll come to the X-rays. So this is your scan from the Trios CAD/CAM scanner. Your top teeth, your bottom teeth, right hand side of your mouth, left hand side of your mouth. So we're going to look at individual arches first. So we're going to look at the top teeth initially. These are your top teeth on the right hand side, left hand side, and towards the front. You've had orthodontic treatment in the past, little orthodontic retaining wire. You've one premolar missing here, one premolar missing there, and that's taken out presumably for orthodontic reasons. On the back, you have a wisdom tooth on the top on the right hand side, nothing coming through yet on the top on the left hand side. So if you bring this closer, we can see your molar teeth here, molar teeth here. Little bit of a staining. On the other side, a little bit of staining there, and all perfectly fine here. Slight little bit of wear on this tooth. I'll just take the color off to show you where this is slightly flat, but in general, it's pretty good. A little bit flat there. Go back to the colored version. What I'm going to do now is to put a staining, a virtual staining on these teeth, and where the teeth have no fillings and where there's natural tooth, the staining will show up where the decay is. Red would indicate that the decay is significant, and yellow would indicate where it's initial, just starting off. So I'll put the staining on here. So what we see is a little bit of yellow, a little bit of yellow, fair bit of yellow, a bit of red here, red there, red here. Now the key is red is moderate to extensive decay and yellow is initial. So I'm going to take this staining off for a second. Little dark spot, little dark spot, little dark spot. So clinically, looking at that, you'd be going, probably decay there, probably decay there. But you wouldn't be 100% sure, because once you drill into a tooth and put a filling in it, then there's no way back as such. So you want to be pretty certain there's decay there before you do that. So that's what this scanner does, helps us in the diagnosis. So we put the staining back on again. That's exactly where those little spots are. So we'd be pretty confident there's decay here. On the other side, you'd look a little bit of a staining. Let's put this, the virtual stain on it, yellow. So initial decay. So we're not going to start drilling into this tooth. We'll monitor this over time, and if it gets worse or it gets a red staining in a year's time, then we can monitor that. Generally, gums are not too bad. A little bit of inflammation. A little bit of inflammation there, but generally okay. So we may need to do a little bit of a cleaning on this. Some wear on this tooth. We'll take the color off for a second. A bit flatter than this side, a little bit flatter, so a little bit of wear. Again, over time, we can monitor how that wear goes. So these are the top teeth, and now I'm going to have a look at the bottom teeth. Bottom teeth, right hand side, left hand side. Wisdom tooth coming through at the bottom on the left, wisdom tooth coming through in the bottom on the right. So you're still young, and it could still be time for this to come through completely. There'll be no problems. Again, two molars, premolar, premolar has been taken out. 6 teeth here, little orthodontic retaining wire. Premolar has been taken out, and there's 2 fillings on the bottom on the left hand side. This creamy stuff here is tartar and we need to get rid of that. This would cause irritation of the gums, bad breath, and also in the longer term can affect some systemic diseases and can contribute to some systemic diseases like diabetes, cardiovascular disease, Alzheimer's, and things like that. Systemic inflammatory diseases. And then we want to show you how to keep this as clean as possible. It is difficult with this orthodontic wire to keep it as clean as possible, but we just want to go through oral hygiene with you as well. On the right hand side, a few teeth have stains here, and again, clinically, these two look as if they need fillings. On the other side, you've had a filling here, had a filling there. Just take the color off for a second. Yeah, they're pretty good. No real interference between the edge of the tooth and the filling. So back over to this side. So clinically, you're going, yeah, potential filling, potential filling. So we'll put a staining on this and see what that shows up. So on the staining, this is initial decay. This is initial decay with moderate to extensive decay as well. So what we would suggest here is doing this filling, not doing this one. So over a period of time, again, monitor this. The filling on this side is showing up as this moderate or extensive decay. That is the way fillings can absorb some of the light from the Trios scanner. But what we're looking at here is a filling that's absorbing some of the light and showing up as decay, but it really only relates to virgin teeth or virgin areas of teeth where there's no fillings already. So again, decay, monitor. I'm going to put the two teeth back together, two jaws back together, and have a look. So these come together quite nicely. We just want to see how they do bite together and what teeth are taking the pressure. Obviously, we want all the teeth to take equal pressure. So we'll just have a little look. We're going to put the clearance here. So this is how your teeth meet. We can't really see that well. So we're just going to switch to view and open your mouth up a little bit. Here, we will take it right down to initial contact between top and bottom teeth. And you can see primarily there's 1, 2, 3, 4, 5 teeth that are taking most of the bite. Generally 1, 2, 3, 4. If you take just to contact themselves, so 1, 2, 3, 4. So this is where the teeth contact each other first. So that would also correspond on the bottom. 1, 2, 3, 4. No real problem here at all. These are good solid teeth. Yes, there's a little bit of decay here. Yes, there's a little bit of decay there. So what we propose is getting you back, doing a filling, smallish filling on this tooth, smallish filling on that tooth, and then monitoring everything else. Monitor the wisdom tooth teeth coming through, and then clean these up a little bit as well. So I'm just going to come out of this and look at the X-rays. So the X-rays on the right hand side, wisdom tooth, this is towards the back, this is towards the front. These are your top teeth, these are your bottom teeth, and this is what you bit together on whenever we took these X-rays. So what a tooth is made up of is the hard outer shell of the enamel, the nerve in the middle, and dentin in between. The hard outer shell of enamel is a protective layer of your tooth before decay gets into the softer dentine. The softer dentine would be eaten away by the decay quite quickly once it gets through the enamel. So what we want to do is make sure it doesn't get through the enamel. And that's what on the scan is doing. Red is through the enamel, yellow is still in the enamel, and with it still being in the enamel, we can slow it down, if not reverse it. Slight little shadow up here We'll just monitor that little shadow there, but it's this one on the scan that's indicating that we need to do something with. The problem with X-rays being two-dimensional, unless something is pretty significant, it doesn't really show up too well on a two-dimensional X-ray. So that's the right-hand side, left-hand side. Top teeth, bottom teeth, towards the back, towards the front. On the bottom, filling, filling. Slight little void in underneath here. So this could be decay underneath this, or it could be just a little bit of a void. We're not going to start taking this whole filling out just to see what's happening there. We would monitor this over time. If it started to get worse, then we have to say that there's something active there. Wisdom tooth on the bottom, fine. Again, between your teeth, looks pretty good. Fine, fine, fine. So what we're going to do is come out of this and go back to the scan. So the scan is basically, here we go. I'm going back to the diagnostic side of it. On the bottom, treatment-wise, filling on the back tooth, on the outside, on this buccal surface. Filling on the top, on the right, on this biting surface, the occlusal surface. And it'll probably extend here, here, here. It'll probably end up as two separate fillings. One in this area, one here, extending through to that. Or it could end up as three fillings. We'll know when we get into the tooth to start cleaning it out a little bit. And other thing we have to do is a bit of a cleaning all over, but primarily at the back of these and at the top here and here. But the most important thing is to show you how to keep them clean, how to maintain good oral hygiene, and also how to minimize these yellow areas going a little bit further into moderate to extensive decay. So you want to reverse these, and likewise on the bottom here as well. Okay, so I hope that gives you an indication of what we think needs to be done, and we'll talk to you soon, Mary. All right, bye-bye.